Perfect. So what are you talking about with people today here at the Cattle Industry Convention?
Well, really my area of expertise, or the thing that makes me the most happy to talk about, is bovine respiratory disease, BRD. And so that's what I'll be spending most of my time talking about, is the disease in general, its effects on our producers, and the solutions that Elanco provides for our producers.
So let's talk a little bit about that, because BRD can be a big problem for cattle producers, the cattle herd.
Yeah.
What should producers do? First, let's start with if they suspect that it may be a problem.
Well, so that's very important, and that's key. The number one thing to be able to do is to have diagnosis. And so we need to take ourselves and become comfortable with what is respiratory disease. Because some of the symptoms, an animal that's heavy breathing, that could be actually acidosis. So that could be a GI problem, or it could be potentially an allergic reaction or something else. And so we need to understand, okay, yes, we have heavy breathing, but do we also have some of the other issues associated with it? Maybe a fever, depression, maybe a snotty nose, those sorts of things, just like we see in our kids. But sometimes it can be difficult, and so making ourselves really comfortable with trying to define BRD versus some other clinical disease.
So once they've discovered that it is actually in their herd, what should a producer do?
Well, the number one thing is preparation and prevention. So we have a lot of antimicrobial, antibiotic solutions that we can provide, and depending upon the situation, some are more appropriate than others, but they're all very good antibiotics, and they can be used. And so once you diagnose that animal, then we have that solution for you. However, we really would rather you prevent it. Even though we produce those antibiotics, that's a tool. We really are interested in preventing the disease. And so, proper nutrition, making sure the animal has a good plan of nutrition, and making sure it's vaccinated. So we're providing a good base level of immunity to allow it to, have the ability to overcome those challenges that will come along. I mean, the one thing with cattle that you have to remember, they're very susceptible to bovine respiratory disease because of their anatomy and their physiology. And so we've got to do everything we can to prepare them to fight off that disease.
Right. So if you could talk to every cattle producer, and you're talking to quite a few here at the Cattle Industry Convention, but if you were to talk to every single one of them, you get a message out all at once, what would that be?
Start with the cow. Make sure we have the cow in good nutritional plane, good nutritional state, so that she can provide a healthy calf, but also provide colostrum. That's one thing we think about a lot in the dairy. We don't, a lot of times we forget in the beef animal, but that's super important. That first milk that provides that passive transfer is so important to get that calf started out. Lots and lots of studies show, all-cause death, but particularly around BRD, getting that good colostrum in it, and then keeping that calf on a good plane of nutrition. Let's try, and before we ship that calf, let's wean it, bunk break it hopefully if we can, but also provide it with at least 2 doses of modified live respiratory vaccine, along with some of the other vaccines before we have it move on. And then also, there's simple management things, reducing stress, reducing commingling, introduction of animals that can help us as well.
All right, thanks so much for your time.
You're welcome.